Hi everyone, welcome to another C2P series. Today we're going to be talking about the should knows of STIs, just kind of like a refresher, and then we're also going to be talking about double standards that Takesha will present after this. So the should knows of sexually transmitted infections. Let's see. Outline, we're going to talk about STI misconceptions, transmission of STIs, treatment and prevention, and testing and treatment locations. So the purpose of this presentation is to educate individuals toward a better understanding of STIs, promote healthy sexual behaviors, strengthen community capacity, and provide access to services to prevent and treat sexually transmitted infections, also known as STIs. Isn't this a great little picture? Language. I wanted to bring this up because oftentimes some people may think that STI and STD are two different things, but it really just means that, they're interchangeable, and, terminology has changed from STD more frequently to STI because there's infections, that can be treated and they may not lead to disease. All right, addressing STI misconceptions. Most STIs have no symptoms, and so this is a fact. Oftentimes people think that if you have an STI, you'll have symptoms, you'll itch, you'll burn, you may have bumps, but this is actually not the case. Most STIs do not have symptoms. And of course, with that, you would be at greater risk of getting an STI that doesn't cause any symptoms. So you're having sex, you have no bumps, lumps, burns, itching, but you still can have an STI. This is why people who have unprotected sex this is how people can contract an STI because there are no symptoms sometimes. And that goes to a person can have an STI and not know it. You can contract an STI from oral and anal sex along with regular penetrative sex or vaginal. Sometimes people don't think you can contract an STI from oral or anal. Anyone who's sexually active can contract an STI. Some people think that it is limited to one sexual orientation or one gender. It doesn't matter who you are, how you identify, you can get an STI. Doesn't matter if you're 15, doesn't matter if you're 29, doesn't matter if you're 85. You can get an STI. So anyone who is sexually active. It doesn't matter if you've had sex one time or 20 times or even more, 100 times. People think if they just have sex once, they're not at risk for contracting an STI, and that is false. The birth control pills, or any type of contraceptive for individuals who identify as female, and PrEP, pre-exposure prophylaxis, do not protect against STIs. Oftentimes people assume that if you are on the pill or if you are on some sort of contraception or birth control or PrEP, they think that protects them from STIs. But what good does that do if you're not using protection? All STIs are not curable. We will talk about that in the presentation. People think that it's okay, I'll have sex without a condom because I could just take a pill, I could just take an antibiotic and I'll be fine. That is false. And then a urine sample does not check for everything. People often think that just by giving a urine sample, you can get tested for HIV, herpes, chlamydia, gonorrhea, when that is not the case. You often have to get your blood drawn for some labs regarding STIs, and sometimes even swabs. A lot of things go along with the urine. We'll talk about that. So STI transmission, we're going to talk about ways STIs are transmitted, and we'll do a refresher on STIs about the types, but I think most people are familiar, but we will get into that later. So oral sex, sexually transmitted infections including HIV, syphilis, herpes, gonorrhea, HPV, trick, and chlamydia can all be passed on during oral sex. Infections can be passed from mouth to genitals or vice versa. To protect yourself while giving or receiving oral sex on the vulva or anus, so vulva is a fancy word, you can really just say, for simple terms, vagina or anus, use a dam, or a dental dam they call it, or a condom cut lengthwise, so vertical, cutting up, to put over the anus or vulva. And then for safe oral sex on a penis, also known as a blowjob, cover the penis with a condom. Okay. Anal sex. Chlamydia, gonorrhea, syphilis, HIV, HPV, herpes, hepatitis B and C can be transmitted via anal sex. Using a silicone or water-based lubricant can also make anal sex safer by decreasing the chances of condom breakage. Having anal sex without lubricant or using saliva or oil-based lubricants, it increases the chance of condom breakage. External and internal condoms can be used for anal sex. We all know what an external condom is. We see them all over. They're the common condoms you see in the aisles, wherever they may be, at the grocery store, Walgreens, or behind the counter at corner stores. Internal condoms, sometimes people call them, another word is female, but internal, really, it could be used for not just females, for everyone. And you can insert that into your anal area. And then don't wear 2 condoms at once, because they will break. Your risk of one of these backdoor STIs increases if you develop small tears or nicks in the thin skin of the anus. And that's how bacteria can get into your system. So that's why we really emphasize the importance of using lube and using condoms, so that doesn't happen, and it reduces your risk of STIs. And then also, just wanted to point out a cool study that the CDC reviewed, in which the US study found that when condoms were used for anal sex with an HIV positive partner, they were 70% effective in preventing transmission of the virus. All right, vaginal sex. Chlamydia, gonorrhea, syphilis, HIV, HPV, herpes, trick, hepatitis B and C can be transmitted via vaginal sex. These are all the STIs that could be transmitted via vaginal sex. The pill does not protect you or your partner from STIs. We mentioned that earlier. External and internal condoms are the only methods of contraception that will help protect you from getting and passing on STIs when you have vaginal sex. I do want to point out that, you'll see some things online that bring up BV or bacterial vaginosis, but that is not necessarily, people argue it could be considered an STI, but really it isn't, because BV is caused by bacteria that's already present in your vagina, and it's normally kept in check by your body's own defenses. But BV can be triggered by sex without a condom or oral sex, because semen or saliva can upset your natural balance and allow some bacteria to flourish. So this is kind of similar to a yeast infection. We have this pH and it has to maintain, its balance, but sometimes it can get out of whack, and then we have a yeast infection. It's kind of the same concept with BV. Okay, STI transmission other. I wanted to put this slide in here because people forget about these things. It's not just oral, anal, and vaginal sex. If you have sex with anyone, no matter their gender or genitals, there's a chance of passing on an STI. If you're touching your partner's genitals or they're touching yours, there's a risk of transmitting some STIs. So HPV is one of them, chlamydia, herpes, and syphilis. Infection risk increases when more fingers or a whole hand are inside the vagina or anus, as this can cause small tears or trauma, which can increase the transmission of STIs. Skin to skin, there's also higher risk of infection if someone puts their fingers in their mouth or a partner's mouth after touching the genitals or anus. If there is any oral sex also involved, that could potentially result in STIs, and they are HPV, herpes, and syphilis. These are spread through skin-to-skin contact, and these sexually transmitted infections are more difficult to prevent than those spread through bodily fluids or blood. So really, even if you have a condom on, you just need to be careful because this is skin-to-skin contact. You could be rubbing on each other, anything, and this could result in potentially, herpes, syphilis, or HPV. You can get those on the skin. It's not just singular to your genital area. Let's talk about treatment. Treatment. Tests for many STIs are as quick and as easy as giving a urine sample, while some tests might also involve having blood taken. Your healthcare provider might also do a visual examination to look for signs of infection or use a swab, like a small soft cotton swab, on the genital, anal, or mouth area. And in some places, home testing kits are available, so you can get tested without leaving home, but that's only for certain STIs. But I'm sure, if you look around at Walgreens, they may have some, CVS, or at some, pop-up clinics. Treatment. There are two types of treatments. Treatment for STI usually consists of antibiotics or antivirals. So we're going to start with antibiotics. Often in a single dose can cure many sexually transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trich. Once you start antibiotic treatment, it's necessary to follow through. If you don't think you'll be able to take the medication as prescribed, make sure you tell your doctor, but it is important because your STI might not clear up if you are stopping your treatment midway. And more importantly, it's important to abstain from sex until 7 days after you've completed your antibiotic treatment and any sores have healed. It's also suggested that you be retested in about 3 months because there's a high chance of reinfection. It is really, really important, I want to emphasize it again, to abstain from sex. Honestly, I would wait personally more than 7 days just to be in the clear. What's the rush? You don't want to have to go back to the doctor and have to, spend your time in a clinic again and taking additional medication for you to just get reinfected again. Okay, and then we have antivirals. Not all STIs can be cured by antibiotics. Prevention through safer sex is the best option. There's no cure for herpes. Antiviral medications can be used to prevent or shorten herpes outbreaks, but the disease cannot be eliminated from your body. There's also no cure for HIV, but there are antivirals to reduce the amount of virus presented in the blood. And this therapy slows down the progression of the disease and works to also reduce the chance of transmitting the disease to any future partners. So really, it's antiviral for both herpes and HIV. If you take it, you can be virally suppressed, and you want to take it at the same day, every single day. And you can really have a safe and healthy sex life by taking your antivirals every day and be really at 0 for your viral load and not transmit the infection to anyone. STI Refresher. So we just talked about all these fancy things. So we're just going to bundle it up and summarize it so you guys have a better idea of what is what. So we have STIs that are considered bacterial, and those are chlamydia, gonorrhea, and syphilis. Chlamydia and gonorrhea can be treated with antibiotics given either orally or by injection. Antibiotics, we think of bacteria. So that's what antibiotics treat, bacteria. If recognized during the early stages, usually within the first year of infection, syphilis can be treated with a IM or intramuscular injection of antibiotic. And then if a person does not recognize the infection early or does not seek treatment immediately, longer treatment with antibiotics may be required. And unfortunately, if left untreated, the infection can progress even further and potentially cause death. This is more, it's not as common today, but this is more geared towards syphilis. because syphilis not often, but syphilis has bad outcomes sometimes if it's left untreated. And then although antibiotics can prevent the infection from getting worse, they can't reverse the damage that's already occurred. But there's new advanced medicine and people are working with that regarding, tertiary syphilis. But if you think you have something or if you're symptomatic, go to your doctor because you want to catch it early on always. Parasitic. So we have trick, we have crabs, pubic lice, and we have scabies. I do want to say that people are a little iffy about considering scabies an STI. Same thing with pubic lice, but really they're just two things to be mindful of. So trick can be treated with a single dose of an oral antibiotic. Often trick infections reoccur. So it's important to make sure that both you and your sexual partners are treated if you're diagnosed with this infection. And then for pubic lice, topical over-the-counter lotions, cream, and shampoos can treat pubic lice. This is another instance of an STI that can be transmitted even when you use condoms. Once again, you can be in the bed, you can be laying on top of each other, side to side, with your clothes off, and this could potentially happen. And then for scabies, scabies are available only with a doctor's prescription. You may see things over the counter, but they are not, they haven't really been approved by medical providers. So make sure if you're itchy down there, it's maybe worthwhile to go to your doctor or to an urgent care clinic or some type of clinic. And then we have viral. We talked about that earlier. Those are HIV, HPV, herpes, and hepatitis. HIV can't be cured. We talked about that. Antiretroviral therapy can be taken to control the virus, and you can be virally suppressed. You can live a wonderful, long, sustainable life till you're 100 if you take your pills every day. HIV is something that can be managed really well. HPV cannot be cured. Many HPV infections can be prevented with the vaccination, which is a 3 series, but there are age restrictions for that. So if you are interested in that and you think you may qualify for it, talk to your doctor about that. Herpes outbreaks. They can be treated with antiviral drugs. While it can limit the length and severity of outbreaks, it does not cure the infection. So of course, like if you are having an outbreak, even if you are taking your antivirals, you want to make sure you're abstaining from sex because this can result in your partner getting infected. And then hepatitis B and C. Hepatitis C is now considered curable through the use of antiviral drugs, and there are vaccines available for hepatitis A and B. Hepatitis A, I just want to know, is more of like, it causes abdominal pain, vomiting, nausea. It's more of kind of like a stomach bug, you can consider it. So say I was going on vacation to somewhere in, I don't know, let's say South America, and I love the vendors out there, the street food. So I would normally go to my doctor and ask to obtain the hepatitis A vaccine. And then of course, like a year later, you would need a booster for that. But that is an example of when you would want to go get it if you think you could potentially, like you're traveling and you're getting sick, if you're traveling and you might get sick, this could help prevent the sickness. Same thing for hepatitis B. There are vaccines available, so talk to your doctor about that. Usually we get our vaccines when we're young for hepatitis B, but inquire with your doctor about that. And then, hepatitis C, I just want to put a little note in there. It's a bloodborne virus, so it can be traveled. Well, hepatitis B basically is a virus that's transmitted through blood and bodily fluids, especially through anal sex. So oftentimes, there are studies out there where people found that they were infected with hepatitis B when partaking in anal sex versus hepatitis C. And of course, antibodies may be carried forever. It's just something to be mindful of. Prevention. Use latex condoms every time you have sex. Of course, if you're allergic to latex, use non-latex condoms. They're out there. Be sure to put the condom on before any skin-to-skin contact involving intimate areas. Remember that some STIs can be transmitted even if there's no penetration and you're using condoms. Get the HPV vaccine if you can. It protects against the most dangerous strains of the virus. Some more prevention. If you're sharing sex toys, then covering them with condoms is a good way to prevent the development of BV or transmission of STIs. Be sure to clean them after every use. Some people use them, just toss them to the side and then use them again. That's kind of gross, guys. So just be sure to clean your toys. And remember to change the condom each time you change partners or when you change from anal to vaginal use. So if you're having sex with Joseph, take off your condom before you have sex with Brian. If you're having sex with Leslie, take off, your condom or whatever you're using before you transition to, Mandy. Talk to your doctor about PrEP and see if you qualify or if you're a good candidate for this drug. Pre-exposure prophylaxis, it protects you from HIV. If you are tested and you are HIV negative, you potentially may be suitable for PrEP. And then testing locations. I want to emphasize the importance of trying to refrain going to emergency rooms for testing. STI testing specifically. Of course, if there are instances, every situation is different, but if you are an individual who might have just had sex and they disclose to you that they're HIV positive or they are at high risk for HIV, or someone, might have told them that they had HIV, previous partner, anything affiliated with HIV, and you're concerned and it's late at night, then of course you can go to an emergency room and ask about PEP, which is post-exposure prophylaxis, and that will help you from contracting, potentially help you from contracting HIV. But in other instances, for the most part, if I just needed to get tested, or even if like some guy called me 2 days ago and said, hey, I just found out I had chlamydia and I know we had sex last week, you may want to go get tested. I don't need to go to the ER for that. That's not necessarily the appropriate setting. So instead, these are all places on top of a lot more places that offer free testing or sliding scale fee testing, and they're great. So we separated them really by the sides of Chicago. Of course, on the south side, if you need testing and treatment, you can go to Care to Prevent, which is us. Here's our number. You can call us. Howard Brown Health on the south side on 63rd. You can call them as well. And they also have PEP services. So that's another way to avoid an ER setting instead of sitting in a waiting room for 10 hours, 8 hours for a simple test. You can also call Howard Brown for PEP. They also offer PEP services if you think you're have been exposed to HIV. There's the Roseland STI Specialty Clinic. On the west side, the two big ones are the Core Center. Here is their number. And then there's also the Austin STI Specialty Clinic, which is on Division. On the north side, the popular ones are Howard Brown, once again, the one on Sheridan. They also offer PEP services, and Center on Halsted. They also have one on Canal as well for an STI testing, but you can call this number to refer you to whichever location. And then, of course, Planned Parenthood. They're all over the city. You can go online, here's the link, and check which one's closest to you and if they offer that service. 99% of them do offer STI testing. Access clinics, those are like your local community clinics. So you have the Lawndale Access Clinic, you have the Austin Access Clinic. They may have different names. You have Miles Square Health over there on the west side, and there's another Miles Square on the south side. These are all access clinics, but they're here at this link. Here are references: CDC and Mayo Clinic. Thank you. And thank you for listening to this presentation. So we are now going to transition over to double standards in relationships, and Takesha will be presenting this. So whenever you're ready, Takesha.
Thank you, Aziza. My name is Takesha. I'm going to be talking about double standards in the relationships. Next. Respect. First, I want to cover some ground things about Care to Prevent. We at Care to Prevent respects everyone. We here at Care to Prevent respect the lives of everyone. We do not support any bias, actions, or unequal rights amongst any human life. This presentation that I'm doing today is here to bring awareness about double standards. In the upcoming slides, you will learn more about expectations and traditional gender roles. Also, you will learn that these expected gender roles can often present a problem where double standard exists. Objective, we're going to define what double standards are, double standards in a relationship. We're going to examine gender roles with couples, review ways double standards can ruin a relationship. I'm going to give some examples of double standard, provide tips on how to deal with double standards, I'm going to cover not accepted double standards in your relationship, and I'm going to talk about double standards within same-sex couples. What are double standards? Double standards is a set of rules or principle that is unfairly applied in different ways to a different set of people or groups. So double standards can be a relationship with same-sex couples. Double standards can be among men and women. Double standards can be related to employment. Double standards can stand anywhere. Double standards within the relationships. When you are in an intimate relationship with one partner and they have the expectations that aren't following themselves. So if your partner expects for you to call, what your partner can be he, she, or he or she, or if you do not identify with gender roles, then just know double standards are among both parties. Each party is guilty of having them. So when you think about double standards, like, I want my partner to call me when they get in home, but I don't do the same. That's a double standard. I expect for my partner to answer my text, or I expect for my partner to pay for meals, or my partner can't use as much money as I. Those are things that we could consider as double standards. How double standards can ruin a relationship. When one partner refuses to change the behavior, that is a big problem. When you are communicating about what your expectations are in a relationship and you notice that there's some double standards and a partner just won't budge, won't refuse to change, yeah, that right there can run a relationship when there's no respect is being shown amongst double standards. Because some people aren't aware that they're doing it, and they have to be brought to their attention. But you still have to have some respect for your partner. Inequality, that is a huge problem, because you saying that one person can do this, but the other person can't do that. Is not fair. So that right there, inequality is very big. People who lives by these examples, on the next slide, risks can be often be ruining their relationship too. So the next slide, I will give some examples in the roles. So these gender roles right here within couple is based on society standards on who should do what, who should have what. So keep in mind, Care to Prevent we respect everybody, but we do not support double standards. Once again, so when you think about society standards, right? It's okay for the male to work outside the home. It's okay for the male to make more money. It's okay for the male. It's always permissible for the male to have more than one partner. The male's supposed to pay for everything. Doesn't have to do housework or care for children. And it's also acceptable to get their needs met elsewhere if partner is not making them happy. So these are some of the society standards of what is acceptable for men, or how men should be. As to females, they look at it, oh, females has to stay home. We're not allowed to be bosses. No, it's not okay for us to make more money than men. In the society standards that many people do not respect female bosses versus respecting the man boss. The female's supposed to be committed to one partner. You cannot, it's frowned upon if a female have more than one partner. Women are made to take care of children in the home. Yeah, and nowadays a lot of females don't want to be home and don't want children neither. That's the things society standards look on, that women are supposed to take care of the children. Females are not supposed to have male friends. It's no. When you figure a female and a male being friends, society looks at it like it's always a sexual thing, that a male and a female can't be friends without having sex. And also too, that women are often told that they need to be content with their partners, with even though they're not being fulfilled in a relationship. So you hear most people tell a woman, or you either hear some mothers will tell their daughters, oh, as long as he got a good job, he's not an alcoholic, he's not beating you, that's a good man. But not understanding that you also have needs, other needs that need to be fulfilled. So if you always got a partner that doesn't like to do these things or doesn't want to try, but you're told that you're not allowed to get your needs met, you're told to be content. But as to a man, it's acceptable if his female partner is not pleasing him, it's okay for him to go out and get somebody else. We'll go to the next slide. Double standards within same-sex couples. Once again, these are not care to prevent expectation, but we just talking about how society see same-sex couples. So we do not, once again, encourage any bias amongst any human life. Same-sex relationships are often acceptable to two females. So you'll hear people say, oh, that is so cute, that is so sexy, when you're seeing two females. But when it comes to a two-male relationship, it's frowned upon, it's disgusting. No, that's not right. That's right there. That's double standard. Or you would say that you'll hear people say, when you hear two female couples raising children, that it's okay. But if two males are raising children, you hear people say, oh, they're going to turn the child to be homosexual. No, that's not true. They are a loving couple, just like two heterosexual couple. What's the difference if two heterosexual couples raising a child and the child turned out to be homosexual? No, it's the same thing. Just because they are the same-sex couple does not mean that the child will turn out to be homosexual. That is wrong, and that's double standard. You also hear the more the feminine partner in the relationship is perceived to be the woman or the most sensitive one. That right there that's double standards. No, just because a person is sensitive doesn't mean because they feminine doesn't mean they're sensitive. That's not true. That is not actual true. Fine. Examples of double standards. Some examples like one partner has to be frugal with money while the other one gets to spend all the money. So if that can be either partner, it doesn't say that it necessarily have to be the woman or the man. It can be either partner. Whoever say, no, we can't buy this, we can't buy this, but you'll see your partner with $200 tennis shoes on, or $500 or $600 purse, but you'll tell your partner you can't spend the money. That's double standard. One partner is expected to call and text and to be answered, but doesn't reciprocate. Why aren't you calling me? Why aren't you answering my text? But if the partner calls that person, they look at their phone and might not answer it. And then when the partner asks why you didn't answer, oh, I was busy. I'm not going to pick up my phone all the time. No, you cannot expect in a relationship to do something, to tell your partner to do something, but yet you're not going to do it with do it yourself. And also, when one partner have friends, but the other partner is not allowed. No, you cannot want your partner to trust you, but you're not going to trust your partner. That is unfair. So another thing is when a partner allows to go through the other partner refuses to allow them to go through theirs. If you're not willing to share your information with your partner, please don't go through your partner's things if you're not going to do the same thing. That's double standards. You're saying it's okay for me to do this, but you can't do it. No, it has to be an equal standards in the relationship. Next one, please. How to deal with double standards. So many reasons, many things can exist, why double standards take place. Consider a reason as to why they are having this type of behavior. So things can come along as the way that this person was upbringing, their past relationship, or to some people, their cultural customs. So you have to look at these things. Bring the behavior to your partner's attention. Say, hey, communicate about what your expectations are and what the things that you do not like. So if you notice this double standards in your relationship, bring it to your partner's attention, because sometimes they might not be aware that they have this behavior. Once again, having an open and honest conversation about what each other needs are and wants are. So if you're not having a clear-cut communication, there's a problem right there. It's a big problem. So once again, bring this type of behavior to your partner's attention to say, hey, this is what I'm noticing. When you do this, you say, I can't do it. Ask why. Continue to talk to that person about what's going on. It's like, we're not to deal with double standards. You don't have to deal with it when double standards lack respect. Once again, everybody is, you have to have respect in your relationship. You cannot have a relationship with there's no respect. So if a person say, I'm going to continue to do this, after you have the conversation, I don't care what you say, this is who I am, nobody's going to change me. Yeah, you don't have to deal with that. No, that's a sign of disrespect, because it clearly states that your feelings and the things that you want don't even matter. When it's clear that the double standards is more than a personality and not a behavior that they were taught or a cultural custom, no. You do not have to deal with it. You do not have to deal with a rude person's personality. No, that is unacceptable, because you have to have equalness amongst your relationship. No, if I cannot have friends, you're not gonna have none. If I can't go through your phone, you're not gonna go through my phone, or better yet, we're not gonna go through each other's phone. That's how it's going to be. So if your partner said, well, we can't be together, if I can't know everything that you're doing, okay, because they don't want you to know everything they're doing. Yeah. So the resources that we have, that it came, some of the stuff came from betterhelp.com. They came from 50 Plus Club. Just talks about the things about double standards. So if you're noticing that you see these type of behaviors in a relationship, please talk to your partner, address those issues, and hopefully you can continue to grow more with each other. Thank you for watching our presentation today.